Hi everyone, and welcome to Healthcare Process Pro. On this channel, I help simplify healthcare process improvement, Lean Six Sigma, and quality improvement so you can confidently lead meaningful change. If you've ever been asked to complete an A3 and thought, where do I even begin? You're definitely not alone. The A3 is one of the most widely used problem-solving tools in healthcare and many other industries. But when you first look at one, it can feel overwhelming. In today's video, I'm going to walk you through a real A3 example section by section, explain what each part means, and show you how all of the pieces work together. By the end of this video, my goal is that the A3 feels much less intimidating and that you have the confidence to begin creating your own. Now let's take a closer look at the background section of the A3. Think of the background as setting the stage for your improvement project. Before we begin talking about the problem or possible solutions, we first need to answer one important question. Why does this project matter? The purpose of the background section is to help the reader understand the history of the issue or opportunity. It provides context and explains why this project is important to your department, clinic, or organization. This is also where you'll summarize what is already known about the topic. Depending on your project, this might include organizational data, benchmarking, industry best practices, or findings from the literature that support why improvement is needed. One of the most common mistakes I see is treating the background section like a research paper and trying to include every detail you can find. Instead, think of the background as telling the reader why this project matters, not everything that's ever been written about it. Your goal is to provide just enough information so that someone who has never seen this project before immediately understands why the team decided to focus on it. Quick tip. If your background starts explaining solutions, you've probably gone too far. Save the solutions for the countermeasures section later in the A3. Now let's look at the example in this A3. In this example, the project focuses on expanding telehealth follow-up visits to reduce hospital readmissions. The background establishes why this is an important opportunity by explaining that hospital readmissions continue to impact patient outcomes and healthcare costs. While telehealth has emerged as an effective strategy for improving access to follow-up care after discharge, rather than immediately discussing solutions, the background simply explains the current landscape and why this improvement project is worth pursuing. By the time the reader finishes this section, they understand why the project exists, which prepares them for the problem statement we'll look at next. Now that we've established why this project is important, let's take a closer look at the problem statement. The purpose of the problem statement is to clearly define the gap between your organization's current performance and where you want to be. Think of it as answering one simple question. What problem are we trying to solve? A well-written problem statement gives everyone involved in the project a shared understanding of the issue before the team begins looking for solutions. In this section, you'll describe the difference between your current state and your desired future state. Whenever possible, support that gap with objective data rather than opinions. I also like to incorporate information from benchmarking activities. One of my favorite practices is reaching out to 2 or 3 organizations that are similar in size or scope to understand how they're approaching the same challenge. Benchmarking often provides valuable insight into what's possible and can help identify opportunities your organization may not have considered. Let's look at the example. In this example, the problem statement clearly identifies the gap between current telehealth follow-up rates and the organization's desired performance. Notice that it focuses on the problem itself. It doesn't recommend expanding telehealth just yet. It simply establishes that there is a measurable opportunity for improvement. Because the problem is clearly defined, the rest of the A3 has a strong foundation to build upon. Quick tip. Before moving on, ask yourself one question. If I handed this A3 to someone outside my department, would they immediately understand the problem without me having to explain it? If the answer is no, your problem statement probably needs to be simplified. Now, let's take a closer look at the current condition section. The purpose of the current condition section is to describe what is actually happening within your organization today. Notice I said actually happening, not what the policy says should happen, not what leadership believes is happening, not what we hope is happening. This section is about documenting the real workflow and the current performance of the process. This is where you'll communicate the current state of the process using objective observations and data whenever possible. The current condition should help explain the gap we identified earlier in the problem statement by showing what the process looks like today. This information often comes from process observations, workflow mapping, interviews with frontline staff, operational data, or direct observation of the work. I especially like mentioning direct observation because it introduces viewers to another core lean principle: go see the work. One of the most common mistakes I see is jumping to conclusions or making assumptions. Sometimes teams describe what they think is happening instead of taking the time to observe the actual process. Another common mistake is confusing policies with reality. Policies describe the ideal process. The current condition describes what people are actually experiencing every day. Let's look at the example. In this example, the current condition describes the organization's existing follow-up process and highlights the current performance. Rather than focusing on how the process should work, this section objectively describes how patients are currently being managed after discharge. By documenting the existing workflow, the team now has a clear understanding of the starting point before designing improvements. Quick tip. One of my favorite questions to ask during a project is, can you show me how this process actually works? Watching the work happen often reveals opportunities that would never be identified by simply reading a policy or procedure. Now let's take a closer look at the gap analysis section. The purpose of the gap analysis is to clearly identify the difference between where your organization is today and where you want to be in the future. Think of this section as measuring the distance between your current condition and your desired future state. By clearly defining the gap, your team has a shared understanding of exactly what needs to improve. After reading this section, someone who has never seen your project before should be able to answer these three questions. Where are we today? Where do we want to be? Why is closing this gap important? A well-written gap analysis keeps everyone focused on the improvement opportunity before the team begins developing solutions. One of the most common mistakes I see is jumping directly to solutions. Once you clearly see the gap, it's very tempting to immediately start brainstorming ideas. But this is where it's important to slow down. Your decisions should always be guided by data, not assumptions. Let the data help you understand the gap before deciding how to close it. Let's look at the example. In this example, the gap analysis clearly shows the difference between the organization's current telehealth follow-up performance and the desired future performance. Because the gap is clearly defined, the team now has a measurable improvement target that will guide the remainder of the project. One question I always ask myself is, can I measure this gap? If the answer is no, then I probably need to make the gap analysis more specific. One phrase I often use during improvement projects is, let the data tell the story. Rather than assuming we know the problem or rushing to a solution, we allow the data to objectively show us where the opportunity exists. Now let's take a closer look at the benefits and return on investment section. The purpose of this section is to help leadership and stakeholders understand the value of implementing the proposed improvement. In other words, this answers an important question. Why is this project worth investing time, effort, and resources into? Many people immediately think of financial savings when they hear the term return on investment. And while financial impact is certainly important, it's only one piece of the picture. Healthcare improvement projects often create value in many different ways. You might reduce staff workload, improve patient safety, increase patient satisfaction, reduce delays, standardize workflows, improve communication, create tools that can be used across multiple departments, or simply give clinicians more time to spend caring for patients. All of these represent meaningful returns on investment. One of the most common mistakes I see is focusing only on financial savings. Financial outcomes are important, but they're rarely the only benefit. Sometimes the greatest value comes from reducing staff workload, improving patient safety, increasing satisfaction, or creating a process that can be replicated across the organization. Healthcare improvement is about creating value, and value can be measured in many different ways. Let's look at the example. In this telehealth example, expanding follow-up visits has the potential to reduce hospital readmissions, improve continuity of care, enhance the patient experience, and lower unnecessary healthcare utilization. Those benefits extend beyond finances. They improve outcomes for patients while also supporting providers and the organization. Whenever I'm completing this section, I ask myself one question. If this project is wildly successful, who wins? The more people who benefit from the improvement, the stronger your project becomes. Don't underestimate the value of time. If your project saves 5 minutes for one nurse, that may not seem significant. But if it saves 5 minutes for 50 nurses every day, you've created hundreds of hours that can be redirected towards patient care over the course of a year. Improvement isn't just about saving money, it's about creating value. Now let's take a closer look at the risks and concerns section. The purpose of this section is to honestly identify potential risks, barriers, or bottlenecks that could impact the success of your project. Every improvement project has risks. Acknowledging them doesn't weaken your proposal. It actually demonstrates thoughtful planning and helps build confidence with stakeholders. The information in this section often comes from your literature review, benchmarking activities, conversations with stakeholders, and your own observations of the current process. As you're planning your project, ask yourself, what could prevent this project from being successful? Identifying these risks early allows your team to prepare and help set realistic expectations. Risks don't always have to be technical. Sometimes they're operational. Sometimes they're staffing related. Sometimes they're financial. Sometimes they're simply resistance to change. All of these are valid concerns that deserve consideration. One of the most common mistakes I see is believing you need to solve every risk before completing the section. That is not the purpose. This section is simply about identifying potential concerns. By acknowledging them early, you're demonstrating that you've thoughtfully considered what could impact the project. Many of these risks will be addressed later during project planning and implementation. Let's look at the example. In this telehealth example, potential risks might include limited patient access to technology, varying levels of digital literacy, staffing availability for follow-up visits, or challenges integrating telehealth workflows into existing clinic operations. Identifying these concerns up front allows the project team to plan more effectively without delaying the proposal. One question I always ask myself is, if this project doesn't succeed, what are the most likely reasons why? The answers to that question usually become the foundation of my risks and concerns section. Now let's take a closer look at the recommended solution section. The purpose of this section is to clearly present your recommended solution, project, or implementation plan based on everything you've learned so far. Notice that we've waited until this point in the A3 to discuss solutions. That is intentional. By first understanding the problem, current condition, gap, benefits, and risks, we can now recommend a solution that's supported by evidence rather than assumptions. This section should answer two simple questions. What are we going to do? How are we going to do it? Whenever possible, your recommendation should be supported by evidence. That evidence may come from your literature review, benchmarking activities, organizational data, pilot projects, or best practices from similar healthcare organizations. One thing I always remind myself is that I don't have to reinvent the wheel. If another organization has already implemented a successful solution to a similar problem, take the opportunity to learn from their experience. Healthcare organizations face many of the same operational challenges, and benchmarking can help you build stronger, evidence-informed recommendations. One of the most common mistakes I see is making the recommendation either too broad or too detailed. If it's too broad, stakeholders may not understand exactly what you are proposing. If it's too detailed, it can become difficult to see the overall strategy. Aim for a recommendation that's specific enough to communicate your plan clearly while leaving room for implementation planning later in the project. Let's look at the example. In this example, the recommended solution is to expand telehealth follow-up visits following hospital discharge. Notice that the recommendation is directly connected to everything we've discussed so far. It addresses the identified gap, supports the project's goals, aligns with the available evidence, and considers the anticipated benefits and potential risks. The recommendation doesn't appear randomly. It grows naturally from the analysis completed throughout the A3. Before finalizing your recommendation, ask yourself one question. Can I explain why I chose this solution using evidence? If the answer is yes, you're probably on the right track. Now let's take a closer look at the follow-up section. The purpose of the follow-up section is to define how you'll evaluate the success of your project after implementation. This is where you outline what data you'll collect, how you'll collect it, and how you'll monitor progress over time. Simply implementing a change isn't enough. We also need to determine whether that change actually improved the process. This section answers one very important question. How will we know if we're actually making a difference? Before implementing any improvement, you should already know which measures you'll monitor and how success will be evaluated. These measures might include quality outcomes, patient safety metrics, operational performance, patient satisfaction, financial outcomes, or any other indicators that align with your project goals. One of the biggest lessons I've learned is to decide what data you'll collect before implementing your change. If you wait until after implementation to decide what to measure, you may discover that you don't have the information you need to demonstrate whether your project was successful. One of the most common mistakes I see is skipping this section entirely. Teams become so focused on implementing the solution that they completely forget how to plan how they'll measure the success. Unfortunately, this often leads to a situation where everyone feels like the project helped, but no one has objective data to demonstrate the impact. Without a follow-up plan, it's difficult to know whether your improvement should be sustained, modified, or expanded. Let's look at the example. In this example, the follow-up section outlines the measures that will be monitored after expanding telehealth follow-up visits. Rather than assuming the intervention will reduce readmissions, the team identifies specific metrics to monitor over time, allowing them to evaluate whether the project achieved its intended outcomes. This creates accountability and supports continuous improvement. Before you implement any improvement, ask yourself, 6 months from now, how will I prove this project made a difference? If you can't answer that question yet, you probably need to strengthen your follow-up plan. Now let's take a closer look at the metrics and results section. I'll admit it, this is one of my favorite sections of the A3. Why? Because this is where the data tells the story. The purpose of this section is to define how you'll measure the success of your project using both quantitative and qualitative data. Numbers are incredibly important, but don't forget that stories, observations, and stakeholder feedback can also provide valuable insight into whether your improvement is making a difference. This section communicates how you'll demonstrate the impact of your project over both the short term and the long term. When selecting your metrics, think beyond the primary outcome. Ask yourself, who else might be affected by this change? Healthcare systems are highly connected. An improvement in one department often creates changes in another. That's why I also like to consider balancing measures such as workflow efficiency, staff satisfaction, patient satisfaction, and impacts to other departments. I always encourage teams to choose a combination of measures. Outcome measures. Did we achieve our goal? Process measures. Did we complete the steps consistently? Balancing measures. Did we unintentionally create problems somewhere else? One of the most common mistakes I see is setting goals that are unrealistic or trying to solve every problem at once. Improvement happens in stages. It's perfectly okay to start with a small, achievable goal and build on that success over time. Setting practical goals allows your team to demonstrate progress, learn from the results, and continue improving. Let's look at the example. In this example, the project measures outcomes such as hospital readmission rates, telehealth follow-up completion, and patient satisfaction. The team may also monitor workflow impacts and staff feedback to ensure the improvement benefits patients without creating unintended burdens for clinicians. Together, these measures provide a more complete picture of project success. One question I always ask is, if this metric improves, will patients or staff actually notice a difference? If the answer is yes, you've probably selected a meaningful measure. What gets measured gets improved, but what gets measured should also matter. Now that we've walked through each section, hopefully you can see that an A3 isn't just a form to fill out. It's really a structured way of thinking through a problem. Each section builds on the previous one, helping you move logically from understanding the problem to identifying root causes, developing solutions, and measuring success. When completed thoughtfully, an A3 becomes a powerful communication tool that helps teams stay aligned and focused on meaningful improvement. Remember, meaningful improvement doesn't happen by chance. It happens one thoughtful step at a time. If you found this video helpful, I'd love for you to subscribe to Healthcare Process Pro for more practical lessons on Lean Six Sigma, healthcare quality improvement, and process improvement. If there's a topic you'd like me to cover in a future video, please leave it in the comments below. I'd love to hear from you. And if you're looking for editable A3 templates like the one featured in today's video, you'll find a link in the description. Thank you so much for watching, and I'll see you in the next lesson. Thank you for joining me today. Keep learning, keep improving, and I'll see you in the next lesson.